Hi, I'm Dr. Tim, chiropractor of our Little Lake Harbor office at Thompson Healthcare Sports Medicine. And today I wanted to go over with you sciatica. What is sciatica, in-office treatments that we can do, and also outside of office treatments that we can do on your own, home exercises, things of that nature. Sciatica essentially is inflammation of your sciatic nerve. Your sciatic nerve is actually your largest nerve in the body. What it does, it runs from your lumbar spine, usually around the L4 area here, and it courses through the hip muscles here, most importantly the piriformis, if you are familiar with that, and it runs all the way down the leg here. And what it does, it helps to innervate all the different hip and leg muscles all the way down there. You could get pinched in the hip there causing all that, or even the leg. Your most common signs and symptoms of sciatica could be either back pain, it could be burning, numbing, tingling, sharp shooting pain, whether it's just in the hip here, all the way the leg down there. It can present one of those symptoms or all the symptoms at the same time, or they can, change inversely there. Your best ways of diagnosing, of course, if need be, if you needed an MRI imaging, that's one way to do it. We can also try to help determine it using different orthopedic exams here. Once we do our orthopedic test, then we can go into treatment within the office. So we have a patient who's been coming in for sciatica pain, and we've been utilizing our chiropractic treatments, including adjustments and a lot of soft tissue work. One thing that happens with sciatica is once you get all that inflammation around the nerve, all the muscles tend to just sort of bundle up and tighten up around to help guard and protect that area. That's why sometimes when you have sciatica, it becomes very stiff, you can't move your hip. So we need to go in there and loosen up the muscles. And one of the ways I do that is using active release technique to help loosen the muscles and decompress, take some pressure off that sciatic nerve. So I like to do a couple of stretches that I will demonstrate that we do in office here. One, I like to keep his leg as straight as we possibly can. By keeping his leg straight, we actually stretch out that sciatic nerve. I'll take a contact on the hip, and we'll move that hip up. So besides just the manual treatment that we just performed on him, there's also another stretch that we can do to really help get that sciatic nerve loosened up from the hip all the way down here. And if the patient is able to, because sometimes the sciatica is just so intense that they're not able to move it on their own, which is why that first stretch is essentially required. But if the patient can move their hip on their own, this is another great way to release that sciatic nerve. So what the patient is going to do, he's going to start in this position. He's going to essentially straighten out the knee, bring the hip all the way up, and then point his toes to his nose. As I do that, I'm going to take a contact on the hip there. So we're going to go over this stretch here. So you're going to straighten out the knee. You're going to bring your hip all the way up as far as you can. And we're going to go toes to nose there. And we're going to hold that, and we're going to bring it down, back to neutral. And we're going to perform that a few times until we loosen up and get some relief in that area. So now I want to demonstrate a couple of at-home exercises and other types of therapies that you can do if you do have a flared-up sciatica and you can't make it to the office, or just to help manage it for the time being there. One of them is a nice little hip stretch here. You can either do it in a seated position, or if you want to get a more accentuated stretch on it, I'll demonstrate on the table, but you can do it on the floor or anything like that. If I have sciatica in my right hip, for instance, I'm going to try to cross my leg over, almost like a figure four here. I'm going to bring my hands around my knees, and I'm going to bring it up, knee to chest here. What we're trying to do is we're trying to help stretch those external rotators. That's usually where the sciatic nerve gets pinched off in the glute muscles there. So I want to sit here and just try to stretch it out there. And you can bring it down this way as well, but this is going to be the best way to get it there. Another way to perform that stretch, if you want to get a little bit more of an exaggerated stretch with it, is a pigeon pose. I'm going to demonstrate on the table here just for demonstration purposes. You can do it either on the bed or on the floor, whatever, like stable surfaces, if you will. But pigeon pose, essentially, if you're able to bring your leg in this position here, so again, this would be the sciatic hip here. I'm going to bring my hip in this position, and I'm going to lean forward into it that way. Hold it for about a good 5 to 10 seconds or until tolerance, and then release it back up. And you can, again, do this. It gets a little bit more exaggerated as compared to the seated stretch. But again, if you're not able to perform that, please do the seated stretch. Another simple at-home trick you can do for sciatica is the old tennis ball trick here, if you will. So whether you're sitting at home, if you're traveling in your car, anything like that, What I like to do is I like to put the tennis ball right on the hip there where that sciatic discomfort pain is there, and you can lean onto it a little bit. And what we're doing is the tennis ball is acting like a pressure point, if you will, and we're just trying to calm down and desensitize that nerve there. So you can do that again at work, traveling, at home, whatever it may be. If you are interested in any more treatment ideas or consults or anything, if you have sciatica or any other issues, feel free to come and visit our office.